Are you a patient of ours?
Naderi, hi, how are you?
Good, how
nice
are
to
you?
meet you.
Nice to meet you too.
This is Matt Taylor, I've got Ava with me.
Yes.
This is like Dr. Miami style, right? I mean, like a lot of cameras, I show like a special suit or a sword. Well,
No, that sounds good.
you won this thing like a long time ago.
Yeah, I know. It's just so hard to get, and
Sorry.
see you. It's
Sorry.
okay.
Welcome.
You're so popular.
Welcome. Where are you? Here it is.
Thanks.
So you're not new to Botox, you've had this before.
Yeah, I've had
That's
Botox
awesome.
like 4 times, I think.
Cool, so you started young, perfect.
Yeah, I used to work for a plastic surgeon.
Who'd you work for?
Dr. Fadi Nukta.
Oh, I know, yeah, nice guy. I like him a lot. Yeah, out in Reston, Ashburn, that area.
Yeah.
Yeah, does a lot of reconstruction and stuff.
I think I've actually met you once before at a Saiton class, but
Maybe a long time ago. Yeah.
Yeah.
Welcome.
Thank
So, I was told you do about 32 units somewhere around the forehead.
Yeah, I think the max I've gotten was 32.
Okay. So let's talk about that. Whenever somebody comes for Botox, they talk about your anatomy, kind of look at you, see what fits your face. I want you to point to the look in the mirror. Where do you think it was injected? What's the primary goal? Oh, you're pretty expressive with the eyebrows.
I know, that's why I need it.
So, but you're very smooth, so you're basically maintaining a nice smooth forehead. Has anybody done around the eyes or not yet?
No, I've never. I don't know if I need it. When I smile, it doesn't really bother me.
Need is a tough thing with Botox, right? Need is really for, at your age, is for prevention mostly.
Right.
So if you actually frown for me, see how strong these muscles are?
Yeah.
There's one here called the corrugator, another corrugator here, and then if you try to crimp your nose here, like yes, you see that?
Mm-hmm.
This is called the procerus down there. And a lot of places when you get Botox, they basically inject the middle, and then the outside goes like that, and you get that kind of Spock eye. Some people like it, most people don't. I love the shape of your eyebrows, I like where they are, so we're gonna try to maintain it there. Can come up or down a little bit there, but I don't want it to shoot up too high, and I don't want it to be flat. I don't like that area on you. Raise your eyebrows for me. You can see your frontalis kicking in. So I do a little bit to the forehead. I don't paralyze you completely. Some people get Botox and they never go back again because what happens, they put so much Botox that the eyebrow just drops and feels so heavy. It feels like there's a horse sitting on your forehead. We don't want that either. So some movement is normal. For you to have some expression is normal too. I think for your forehead, 25 units is plenty. If you had 32, we can do 30, that's fine. But let's look at the eyes now. Bring that up. Smile really big. Big. You're not really forming that much crow's feet, but just one little line is forming here. So to prevent this from getting deeper, I put just 2 drops right there.
Okay.
So, you've got the prize. It's free Botox. Why don't we just use it? Yeah?
Yeah, sounds good.
Let's do 35 units. So I'll basically put a little bit around here, and the rest will go up top and around the forehead as well.
Yeah, what bothers me a lot, sometimes I'm not even mad that I, like this right here would look like that for
It's a
few
resting
minutes.
tone.
I'm like,
So think about resting tone. If you do yoga, if you meditate and you sit there and you think, oh, I'm pretty relaxed, but then as soon as you start meditating more, you're like, oh my God, my muscles are pretty tense. So there's a resting tone in some people that just are like in that muscles frowning without even knowing it. The beauty of Botox is it kind of softens it up. You have a perfectly fine, smooth forehead, but let's make sure the next 20, 30 years it stays this way, you don't form lines. Yeah.
Sounds good.
So let's do it. So we'll do some Botox. Any questions about the consent? It's the same as probably you've signed elsewhere in other places. Okay.
No question.
Let's do it. So I need 35 units, and we go with Botox itself. The other options are Dysport. You may have heard of Zomin.
I've had Dysport and Xeomin too.
Yeah. What's your favorite?
Botox, I think have had it the most. I was happy with. Dysport was actually not bad either.
Yeah. So Dysport and Botox are my favorite. And the funny thing is, even though Botox is kind of the gold standard, it's like the Coke. Dysport is more like Pepsi, and most people can't tell the difference. It's Coke or Pepsi, one or the other. I would put Zomin, as a distant third. There's really no reason for it in my practice. Some people like it because you don't have to store it refrigerated. You can put it like just a shelf and doesn't have to be in a fridge or a freezer. So you switch to Dysport. Almost 8 out of 10 of them are like, how come you didn't tell me about this before? They prefer Dysport.
Wow.
Or maybe they can't tell the difference. They just like the fact that it works faster. 2 out of 10 come back and say, nah, I like Botox more. And for those, the reason almost always is Botox lasts longer for them. Nobody knows why. That's just the way it is. That's how the cookie crumbles. All right, so we're going to do 35 units. You know that it takes up to 2 weeks for it to fully work, but in about 3 or 4 days you start to see something.
Okay.
The little tiny bumps that you'll see under your forehead, go away by the time you get home. Where are you going after this? Are you going home to work?
I'll be going to work at 5.
Okay. You'll be fine.
Nothing, I'm not working out when
You'll
I'm
be
doing
fine.
work, so I'll be fine.
Work at 5.
Yeah, what kind of? See, I can't get my.
I
staff
typically work in the morning, but I wanted to come and get my Botox. So.
See, my staff at 5:01 like disappear. All right, let's do it. Close your eyes, happy thoughts. So we're gonna go first for the procerus right here. And then we're gonna get the medial depressors. We do a little bit to the medial corrugator, lateral corrugator. And this is the drop that's going to prevent you from turning into Spock. Now again, it's cultural as well. Some of my Middle Eastern patients love that high arch. But you have a really pretty arch to begin with.
Thank you.
You're welcome. The muscles are different from side to side. So the injection is a little bit different from side to side.
Right, this eyebrow is a little bit lower, I think, on that side.
Yep, the left side is almost always a little bit higher on 90% of people. So the anatomy is a little different. How you holding up?
Oh, I'm fine.
You need a break?
No, thank you.
Good.
I can barely feel it.
Good. So for the injections, typically people say, how long does it last? You know it lasts 3 to 4 months, right?
Right.
In 3 or 4 months, it's completely gone. You start from scratch. People that come in and swear, oh, but last 6 months, and the explanation is it's gone in 3 or 4 months, but you kind of forget how to make that move for maybe a month or 2. It almost wipes out your muscle memory. So it may last a little bit longer based on that, but it's not that it's lasting that amount of time.
Right.
Raise your eyebrows again. Good. Perfect. I'm going to put a little extra drop right here. And this is a little bit higher dose than I normally do, but it's because it's nice when it's free. Why not give you a little bit more relaxation?
Thank you.
Normally we're trying to save people money, and by charging by units, not by area, you know exactly what you get.
Right.
And then we can always tighter it up or down. You can come back and say, well, I want a little bit more of a freeze. Sure.
I'm so excited. Everybody was jealous when I won this.
We have Secret Service protection for you while you leave, so your friends don't attack you. Just a couple more spots. This drop here prevents your eyebrows from dropping when you smile. So when you smile, the eyebrow stays up, which is pretty. No bruises. The little bumps will be gone by the time you get to wherever you're going in about 20 minutes. I'm just going to clean you up a little bit.
Thank you.
You're welcome. Normally I have assistants, but now everybody's a videographer.
We're your camera people now.
Or you guys should videotape each other. Videotape it. Say hi. Who's live? Are you live?
Me?
Hi. I think this is the first time we've done live, right?
Yep, it is.
Oh, nice.
You took my bad side, my left side first.
This is my good
Right?
side.
Everybody, 90% of people, if not the left side, is the better side because it's a higher eye, higher cheekbone. Yeah, we're all like that.
Thank
But
you so much,
you did
Dr.
well.
Naderi.
You did well.
Thank
Great.
you.
Good to see you.
Thank you, girls.
Bye, guys.